of the newborn. Neonate apical pulse or heart rate is 120 to 160. Initial care of the newborn. Assessment. Observe or assist with initiation of respirations. Assess Apgar score. Note characteristics of cry. Monitor for nasal flaring, grunting, retractions, and abnormal respirations such as seesaw respiratory pattern. Rise and fall of the chest and abdomen do not occur together. Assess for central cyanosis and acrocyanosis. Obtain vital signs. Observe the newborn for signs of hypothermia and hyperthermia. Assess for gross anomalies. Interventions. Suction the mouth first and then the nares with a bulb syringe. Dry the newborn and stimulate crying by rubbing the back. Maintain temperature stability. Wrap the newborn in warm blankets and place a stockinette cap on the newborn's head. Keep the newborn with the mother to facilitate bonding. Place the newborn at mother's breast if breastfeeding is planned, or place the newborn on the mother's abdomen. Place the newborn in radiant warmer. Position the newborn on the side with a rolled blanket at the back to facilitate drainage of mucus. Ensure the newborn's proper identification. Footprint the newborn and fingerprint the mother on the identification sheet per agency policies and procedures. Initiate other agency identification and safety procedures. Place matching identification bracelets on the mother and the newborn. Apgar scoring system. Assess each of 5 items to be scored and add the total points to determine the newborn's total score. 5 vital indicators. 4. Apgar score system. Interventions. Apgar score. The newborn's Apgar score is routinely assessed and recorded at 1 minute and at 5 minutes after birth and at 10 minutes if needed. Initial physical examination. Keep the newborn warm during the examination. Begin with newborn observations and then perform assessment that are least disturbing to the newborns first. Initiate nursing interventions for abnormal finding and document findings. The Ballard scale may be used for gestational and age assessment. And in this scale, scores are assigned to physical and neurological criteria. The Ballard scale may be used for gestational age assessment. And in this scale, scores are assigned to physical and neurological criteria. The phases of newborn instability occur during the first 6 to 8 hours after birth and are known as transition period between intrauterine and extrauterine existence. These phases include the first period of reactivity, period of decreased responsiveness, and second period of reactivity. The phases of newborn instability occur during the first 6 to 8 hours after birth and are known as transition period between intrauterine and extrauterine existence. These phases include the first period of reactivity, period of decreased responsiveness, and second period of reactivity. Vital signs. Heart rate resting 120 to 160 beats per minute. Apical. When sleeping, apical pulse is 80 to 100 beats per minute. When crying, it's up to 180 beats per minute. Auscultate at the fourth intercostal space for 1 full minute to detect abnormalities. Respirations 30 to 60 breaths per minute. Assess for 1 full minute. Assess heart rate and respiratory rate first before assessing other vital signs while the newborn is sleeping or resting. 5 vital indicators of APGAR scoring: heart rate, respiratory rate effort, muscle tone, reflex irritability, skin color. 0 is absent on heart rate, 0 is absent on respiratory rate, 0 is flaccid limp on muscle tone, 0 is no response on reflex irritability, 0 is pallor or cyanosis in skin color. 1 point if heart rate is less than 100 beats per minute. 1 point if respiratory rate or effort is slow, irregular breathing, weak cry. 1 point for muscle tone if minimal flexion or extremities. 1 point for reflex irritability if minimal response grimace to suction or to gentle slap on soles. 1 point for skin color if body skin is normal, extremities blue. 2 points for heart rate if more than 100 beats per minute. 2 points for respiratory rate if good rate and effort, vigorous cry. 2 points for muscle tone if there's good flexion and active motion. 2 points for reflex irritability if responds promptly with a cry or active movement. 2 points for skin color if body and extremity color, skin color normal. APGAR score interventions. 0 to 3 score intervention. Newborn requires full resuscitation. Rescore at specific intervals. Score 4 to 7 intervention. Stimulate, rub newborn's back, administer oxygen to newborn. Rescore at specific intervals. APGAR score 8 to 10. If the score is 8 to 10, there is no need for intervention required except to support newborn's spontaneous efforts. Auxiliary temperature should be 96.8 to 99. Auxiliary temperature should be 96.8 to 99. Blood pressure, usually not done in term newborn, is 80 to 90 over 40 to 50. Body measurements approximate. Approximate length is 18 to 22 inches. Approximate weight is 5.5 to 8.75 pound. Approximate head circumference is 13.2 to 14 inches. Head should be 1/4 of the body length. Cephalocaudal development. Bones of the skull are not fused. Sutures, connective tissue between the skull bones, are palpable and may be overlapping because of head molding, but should not be widened. Fontanelles are an ossified membranous tissues at the junction of the sutures. Molding is asymmetry of the head resulting from pressure in the birth canal. Molding disappears in about 72 hours. Masses from birth trauma. Caput pseudodenum is edema of the soft tissue over bone. Crosses over suture line. It subsides within 5 days. Anterior fontanelle are diamond-shaped soft flat, 3 to 4 centimeter wide, and it closes between 12 and 18 months of age. Posterior are triangular, located between occipital and parietal bones. Posterior closes between birth and 2 to 3 months of age. Cephal hematoma is swelling caused by bleeding into an area between the bone and periosteum. Do not cross over suture line. It usually is absorbed within 6 weeks with no treatment. Head lag, common when pulling the newborn to a sitting position. When prone, the newborn should be able to lift the head slightly and turn the head from side to side. Eyes, slate gray for light skin, dark blue or brown gray for dark skin. Eyes should be symmetrical and clear. Pupils equal round, react to light and by accommodation. Blink reflex present. Eyes cross because of weak extraocular muscles. Ability to track and fixate momentarily. Red reflex present. Eyelids often edematous as a result of pressure during the birth process and the effects of eye medication. Ears should be symmetrical, firm cartilage with recoil. Top of pinna on or above line drawn from outer canthus of eye. Ears, low set ears associated with Down syndrome. Nose are flat, broad in center of face. Obligatory nose breathing. Occasional sneezing to remove obstructions. Nares are patent and should not flare. Flaring is an indication of respiratory distress. Nares are patent and should not flare. Flaring of nose is an indication of respiratory distress. Mouth should be pink, moist gums, soft and hard palate intact. Epstein pearl or small white cysts may be present on hard palate. Uvula in midline. Freely moving tongue, symmetrical, has short frenulum. Sucking and crying movements symmetrical. Able to swallow. Root and gag reflex present. When assessing the newborn's mouth, look for the presence of thrust, Candida albicans, which are white, patchy areas on the tongue or gums that cannot be removed with a washcloth. They may be painful. When assessing the newborn's mouth, look for the presence of thrust, Candida albicans, which are white, patchy areas on the tongue or gums that cannot be removed with a washcloth. They may be painful. The neck should be short and thick. Headline in midline. Trachea on midline. Good range of motion and ability to flex and extend. Assess for torticollis. Head inclines to one side as result of contraction of muscles on that side of neck. Assess for torticollis. Head inclines to one side as a result of contraction of muscles on that side of the neck.